The National Department of Health must establish a database featuring the personal information of those who have been tested for COVID-19, those who are infected, and those who were in contact with them. Some South Africans are now asking whether this is not an unjustifiable infringement on our constitutional right to privacy. And therefore, government needs to take the steps they have to in order to spread the limit of the virus. However, when they take our personal information and where they store it must be done in a responsible way and only to the extent that is necessary. How will my personal information be accessed or recorded? This is a question we've received quite a few times since the April 1 regulation amendments, and the answer is this. If you go for COVID-19 testing and you give a sample at a lab, for example, the person who is conducting that has the responsibility of taking down your name, your surname, ID number, passport number, where you reside, as well as your contact details. They must then submit it to the National Director General of Health. The National Institute of Communicable Diseases must also, in terms of the regulations, submit the information that they have regarding COVID patients and those they've been in contact with to the Director General of Health. Electronic communication service providers have been directed to assist the Director General when asked to do so in order to track the movements of someone who has been infected or who has been in contact with an infected person. There is a limit to this though. It does only apply from 5 March 2020 until whenever the current regulations and the national disaster comes to an end. There is a limit to this though. It does only apply from 5 March 2020 until whenever the current regulations and the national disaster comes to an end. What steps are government taking to ensure that this doesn't get out of hand and that our privacy is still protected? Luckily, in terms of the regulations, there are a few. Your information may only be retained on the databases for a limited time. We'll go into what that limit entails in a second. The information must be treated as confidential and nobody is allowed to disclose it. That is per the regulations, and we all know that if you do not adhere to the regulations, you can be criminally charged. It was specifically highlighted in these regulations that the DG is not authorized by any means to intercept communications. So that is good news. It indicates that there are really strict limitations on this. In addition to that, the Department of Justice has been mandated with appointing a COVID-19 designated judge, and this judge will then receive the information from the Director General of Health, and the DG will send the judge reports and updates regularly. And this judge may then make recommendations so as to further safeguard our right to privacy. Once the national state of disaster has either lapsed or been terminated, the DG of Health has to inform every single person whose personal information is on the databases. The info on the databases must then be de-identified. That means the information must be removed from the person to whom it refers, and information with which that is impossible must be destroyed. And that concludes our summary of the Department of Health's national database of COVID-19 patients and those that may have been in contact with them. Check out your Caxton local media news websites for the latest regarding the virus and its developments.